We have talked about ERs, the situation in the emergency rooms, how dire it's been. Lakeshore General Hospital is, of course, in the focus for quite some time. But now a new story, new report by Montreal Gazette health reporter Aaron DERFEL paints a pretty grim picture, one that we haven't necessarily talked about, which is more and more people who end up in ERs actually leaving before ever being seen by a doctor. And the numbers are rather startling. Aaron DERFEL is on the line. Aaron, thanks for being here again.
My pleasure, Aaron.
First thing I will point out is in looking, first of all, this comes from a confidential report that you managed to, I guess, get at the Gazette, right?
Mm-hmm. Yes, exactly. And it's just so incredibly detailed. So many charts, 79 pages, chock full of statistics.
I will point out the one thing that really kind of threw me for a loop is you look at the diversity, the wide range of outcomes, right? So you have the Jewish General Hospital at about 5.1%. Then you have the Jean Talon Hospital at 24% of those there leaving without being seen by a doctor in ER.
Yes, that's at Jean Talon, it's 13.7%. I think you're referring to the hospital.
I'm sorry, I'm talking about Saint Eustache. Right, exactly.
Yes, yeah. So the Jewish General is at the lowest, and there is this big variance, and what that suggests is that some hospitals are managed better than others, and that the lesson to learn here is to perhaps look at the best practices of the better performing hospitals and adopt them in those ERs that are faring very, very poorly, because it's not normal that for example at the CHUM, which is the French language super hospital, that almost 1 in 5 patients leaves the ER without being seen by a doctor. Most of those who study this sort of thing, the outcomes are not necessarily bad, but there are cases. There was this case in the Maritimes of a woman who was stuck in the ER for many hours. She left in frustration and she died of a heart attack at home. So this is not negligible, and it's just another symptom of our ERs in crisis, because they're tracking these numbers over the past 5 years and they're getting worse.
And I think that's what I'm perplexed by, the confidentiality of this report. Surely this can only help to improve things. If you expose how grave the situation is, it would help to improve it. Would it not? Is that too logical, Aaron?
I agree with you totally, Natasha. To give credit to Christian Dubé, the health minister, he has been posting more and more ER stats on the government's dashboard, so that's a positive thing. But this report, it's just there are just so many details that I haven't come across, because obviously the department has medicine, Department of Emergency Medicine. It has access to all of this data, and I'm actually following up with another bombshell story in tomorrow's Montreal Gazette on another troubling aspect of the ERs.
Well, I want to go back to Christian Dubé. If we're going to give credit where credit is due to some degree, I think we have to point fingers in others, because it seems to me, as mentioned in your story, it was Christian Dubé who said that ERs would improve or had improved after he created those so-called crisis cells. That's apparently not the case either. So what were they supposed to have done? Just reduce overcrowding?
Cynics would say that's just a buzzword. It's marketing. And yes, they did set up this crisis cell, and I spoke to a couple of members of the crisis cell. They are trying to implement some measures to reduce ER overcrowding. But as we've discussed on this show previously, the fundamentals are just not there. There's a severe shortage of nurses and other specialists. So the government has had to close 2,000 beds across the province hospital beds, and then this backs up into the ER. The ERs are overcrowded, and you have patients who either languish on stretchers in the hallways for sometimes up to 5 days, say at the Royal Vic, or if they don't want to go through that horror, they just get up and leave. And after my story was published online, a 69-year-old patient who had been to the Royal Vic, he contacted me to talk about his experience and how he had to leave. And I'll be interviewing him tomorrow in more detail to write about his experience.
There's a lot of, we're sitting here both kind of shaking our heads. You kind of wonder at what point will things finally start to get better. There's a term for this now. I wasn't even aware of this before that you mentioned, right? LWBS, leaving without being seen.
Yes, exactly. And, that's it's almost like a subculture, right? They have these different abbreviations. So this is a known phenomenon. It's a problem across the country too. It's better in Toronto, but Alberta has struggled a little bit. It's much better in the United States, but the U.S. system is different because they're for-profit hospitals. Right. Make money for every ER patient that they get, so they don't want them to leave. But, our system is universal healthcare system, so we're not supposed to turn patients away. But what's happening is patients are turning themselves away.
I'm very intrigued by this notion of secrecy. Like, you spoke to so many people off the record. They agreed to talk to you about how bad the situation is, but only if you didn't name them. I think the only person named is someone who's no longer working in the system. Is there just a culture here that it's not okay to speak out about the horrors that happen in an ER on a daily basis?
Absolutely. There's this unofficial law of omerta. The government did set up this tip line called On vous écoute, but as I revealed in my series about the Lakeshore ER a few months ago, you had nurses who used that tip line, and then people in Christian Dubé's office, they didn't respond. This is clinical sources tipping off the hotline to the fact that patients were dying what should have been preventable deaths, and nothing was done. So, despite the fact that they set up this tip line, there is this fear to speak out, and so when sources contact journalists like me, what they do is they say, "Don't publish my name, because if you publish my name, I'll get fired." I've had sources who have been fired for speaking out, and so it is a real danger.
I did want to mention one thing, though. This is not a hospital or a couple of hospitals. I think your story says out of 15 Montreal hospital ERs, 12 of them have seen things get worse as far as this goes.
Exactly. And that's why, I'm writing about it because as a reporter, I have to hold the government accountable. So Christian Dubé comes out and he says, I've launched a setting de crise and we're going to fix the situation. And so a few months later, 6 months later, I'm continuously writing about this and fact checking and verifying and holding the minister accountable. And I really don't see the situation improving. That's being laid out in these statistics, and it's also being reinforced by my sources, whether they are doctors or nurses. You'll recall I wrote a story about how the staff at St. Mary's Hospital say a prayer now for the start of each shift because things are so bad. So I just have to keep hammering away at this, to raise awareness about this, because this is a matter of paramount public interest.
And Aaron, I'm just wondering, in terms of the outcome for those who leave without being seen, there's no real way of tracking that, is there? Like, I know they follow up with some of them, but there's no real way to know what happened with so many people who weren't seen.
Yeah, so, the gentleman that I mentioned a moment ago, the 69-year-old man, he said the Royal Vic did call him up after he left. So they, as a matter of routine, they're supposed to. And one of my ER sources said a few years ago, when he came in to start his shift as a doctor, he might see one or two of these files, but now he sees like a stack of them. So he has to call up patients and track them down. Like, this is absurd. Wow. It's Kafkaesque. It goes against what ER medicine should be about. An ER doctor shouldn't be trying to track patients who've left without being seen after the fact. He has to respond when they're in the ER, and this speaks to just how bad things have gotten.
You know what? First of all, again, we're sitting here going, I can't believe I'm actually hearing this. Just when you think, or you want to think, or want to hope that things are getting better, you hear and see stories like this and realize they're not. You mentioned you have a follow-up on this tomorrow?
Yeah. So I'll just give you, the listeners, a bit of I'll scoop myself a little bit and share a little bit, because, the competitors are not going to be able to get this. But, they have triage guidelines. So you have a P1 patient or level 1, they should be seen immediately, right? They've suffered a heart attack. And then it goes all the way up to P5. And the stats show that for things like P3 patients who should be seen within 30 minutes, right? That it's taking hours for ER doctors to examine these patients. So the situation is so bad that we're falling short. That the system is falling far short of the triage guidelines, and there can be repercussions too. A veteran triage nurse whom I interviewed said that they were aware of P3 patients who died before being seen by a doctor because it took too long to be seen by a doctor.
I'll look for that tomorrow. Aaron, thank you so much for the time. Again, terrific job. Appreciate it.
Okay, my pleasure.
Aaron DERFEL of the Montreal Gazette. Wow.
It's astonishing.
Incredible.
Thank God he does the work he does. I think we say it literally every time we speak to him.
Agreed.